Good evening, everyone. Excuse me for the interruption, but we have breaking news on the BSCOSO channel. Because tonight we have a special guest from Brazil. This is Dr. Vanessa Castro. Hello, Vanessa.
Hi, Simonas. Good afternoon.
Good afternoon, Vanessa. Vanessa is a maxillofacial surgeon who works in Brazil. She's an oral surgeon at Aliança Hospital, Portuguese Hospital, and other private hospitals, and also is in private practice in maxillofacial surgery dedicated to ortognatic surgery. Vanessa, we are very happy that you're coming back to the BSCOSO meeting after 1 year break. You gave a brilliant course last year in the winter course, and now you're coming back for the TMJ meeting, and we are very much happy about this. What you're going to speak about this time in the meeting?
Oh, Simonas, for me it's a pleasure to be with you one more time. Every year I would like to go to Vilnius to be with you and share our experience. And this year we are going to talk about the management that we do, how we make with TMJ disc displacement in patients that are going to do ortognatic surgery, even they are class 2 or class 3 patients. How we manage this kind of pathologies with ortognatic surgery. That's it.
I see. What specifically are you going to speak about TMJs? What's your protocol?
Our protocol, we have to make the right diagnosis, first of all, with our patients that have craniofacial deformities. And after this, we are going to indicate it sometimes to do TMJ surgery. And when we indicated this, we do it at the same time at ortognatic surgery because it is unique procedure, just one procedure. And other reason is because when you do TMJ surgery to make the disc repositioning, you change the occlusion a little bit. You create a little open bite on the back, and you put the mandible a little bit forward. So we think that if the patient is going to do ortognatic surgery, we can make this at the same moment, and it's better for the patient. So I'm going to talk about this protocol. In many patients, we have this displacement, but we don't indicate the TMJ surgery. So we are going to see these patients from MRIs, pre and post, the follow-ups, and how these condyles are going to behave afterwards years ago.
Okay, from what you said, I have a feeling that you perform quite a lot of disc repositioning surgeries in ortognatic cases before surgery or simultaneously with ortognatic surgery. What does it give to your patients? How do you compare with the results when you do not do TMJ surgery and just do ortognatic surgery with diseased joints?
No, sometimes we have some different aspects in the condyles, and we have some changes and resorptions, and many times we can control this, and it's like a remodeling and accommodation in 1 to 2 years, and we stabilize the occlusion. Other times, no, we have some resorptions that are more important, and you change the occlusion. So I think what is the most important thing is to indicate the right patient to do this TMJ surgery. It's not all the patients, but no patients. We have some patients that have pathologies, and we need to go straight to TMJ and do the right position of the disc and, save that condyle. And you have patients, if you do big counterclockwise rotations, big movements. Here in Brazil, we have like patients that we make 25, 30 millimeters forward and counterclockwise rotation. So I think it's almost impossible to have nothing in these condyles afterwards. So we have to make sure, and it's not easy to know exactly which patient you need to do surgery or not, but sometimes it doesn't work very well, just to be conservative in these patients. So we have some patients that will be fine with these condyles and occlusion after the surgery.
Okay. Vanessa, I know that you have a brilliant collection of MRI images taken before and after TMJ surgery showing the success of your results, of your treatment protocol. Are you going to bring this collection with you and show us?
Yes, of course. I'm going to take with me, and bring to Vilnius the MRIs. We do a protocol like here in Brazil. It's not so difficult to have MRIs. So I have MRIs pre and post 6 months and post 1 year. So we have all these follow-ups, and I can see my patients many, many times. So I have follow-ups of 5, 8, 10 years after the surgery. I will bring with me and show you how these TMJs are going to be many years after the surgery.
Very nice. And the last question, what is your message for the audience? There are about 20 participants from 28 countries coming to listen to you. Some of them are dentists, some of them are surgeons. What will they learn from your lecture, and what do you expect they can bring home, and what they will use in the practice?
Okay, my message is that I'm going to bring what I have, the best that I have, to share with you, and to show you that we have to discover and to make the right diagnosis for each patient that we have. We don't have like a protocol for everybody. The way that we treat patients cannot be the same for everybody. That's the most important thing, is to see your patient like the unique patient that you have, and try to find what that patient needs, and the right surgery or the right treatment, even if the patient don't need treatment, anyone. So we have patients that are going to do all the surgeries because that patient needs that, and the others no. So I think I'm going to show the truth, what we do here in Brazil. I'm going to show follow-ups of 5, 10, 15 years after ortognátic surgery with CTs and MRIs, and what happened with this patient. That's the way that we treat here. We take the patient like the unique patient to treat that problem. That's it.
Thank you, Vanessa. Tonight's our special guest, Vanessa Castro. She's a maxillofacial surgeon from Brazil. She's going to present next month at BSCOSO course, and she's going to speak on TMJ treatment in terms of disc repositioning surgery, and she will show her brilliant results of long-term follow-up after ortognátic surgery performed simultaneously with the TMJ treatment. Thank you, Vanessa, for being with us tonight and this night, and I hope to see you soon next month.
Okay, thank you, Simonas. It's a pleasure for me to be with you here, to be with you in Vilnius next month, in April.
Thank you.
Bye-bye.
Thank you.